in line with?
S2.
S2, good. Iliac crest?
L4.
L4, good. Okay, so you can almost work out where we are, give or take. Alright, so L4, PSI, SS2. So below this finger will be L5 here, and above this finger will be S1. Yeah, in that sort of area in here. Now, you can probably come on to, so I'm on L5, S1 now, where my thumb is. That's where we are. Okay, so that's where my thumb is. So L5, S1, so it's called the LS, which is the lumbosacral junction. Yeah. Now, think about what we did in terms of palpation. Not so easy in the lumbar, but some people find it easier. If we say it's in relative neutral here, we can do motion testing as well. It just takes time. So if we find L5, and then where's my cool sign? There it is. This one. No, excuse me doing this. Now, if you think about where L5 is located, if I brought my thumbs lateral, can you see I'm on the facet joint? Yeah? But look where the TP is. Look how far lateral and superior the transverse processes of L5 is over here. So if I find L5 and bring my thumbs across, I'm not going to be on the TPs, am I? I'm going to be more facet. So I have to bring my thumbs across and go up, almost like quite far lateral. Almost between L5 and L4, you can see the transverse process of 5 is here. Alright, so you're going to have to come quite far lateral to that. So 5 to 4, so when I find the spinous process, you go above it to 4 in between and come across, and then it roughly will take you onto the transverse process. So that's what we could palpate, is look at that one to start with. So maybe come on to 5 and go to 4, bring your thumbs lateral, and my left thumb sinks in further than my right thumb. So the right side is more shallow and the left side is more deep. Now, if I said to him to do extension flexion, come up with your elbows like you read in the book, please. This is like the Sphinx position. So from this position, now if I come on to 5, 4, come across again, and now my thumbs are more level in extension, and then go back down again. And that right thumb is more shallow. Now if I said to him, rotate your pelvis, no, not the other way. There, that's it. So now he's flexing his lumbar. And then now I come across. Okay, the left side still goes deeper and the right side is more shallow. Let's make sure I'm around. Yeah. So the right side is more shallow compared to the left side is more deep. So what might I say, if I'm going to say anything?
The left is stuck?
No. Right stuck in which way?
Close.
Close, good. Okay, so right side, so that could be one way of palpating. I'm not saying you all the time to do this, but I'm just, mostly videoed it anyway. So you could assess it that way. I've got some videos on this. So because in flexion, he's got a shallow side. Remember the mnemonic here, in flexion, yeah, it's fixed closed. Whereas in extension, if it's the deep side is fixed open. Okay. So if I'm going to say, I say dysfunction side up. So if I'm going to say the right side is closed, so I'm going to say right side is up. So Matt, can you turn around? Put your head here. Yeah.
Front?
Yeah, on this side, on this side. So right side is up. Yeah, dysfunction side up. Happy with that for a sec? Yeah. Now, if you think about it logically, does it really matter? Because when you see someone like me or some other osteopath or chiropractor, once I've done one side, what do they normally do? 99.9%. Turn around and do the other side. You could argue if you're opening the top joint, what are you doing to the bottom? Close it. Yeah, so if the diagnosis is not correct as such, then if you think it's closed, it might not be, it might be open. So when you are opening, you're actually closing as well. So most of the time, the osteopaths, if I do your neck, I probably will do both sides. Yeah, should we? Maybe not, you could argue it, that sort of thing. Now, in this position, let's say we want to open that facet of L5. The bottom leg, okay, the bottom leg is straight. Now, what I tend to do is put the top leg, foot, we can vary this. Some books will say different things, but we can make it, we spend all week just doing lumbar. So from here, this is flexion, so we initiate opening from below. All right, this is just stabilizing. Yeah, there. Some books will argue what position, but if you put the foot in the crease of the knee, we can adapt that, rather than saying, well, that's 4, and that's 5, and that's S1. Now, from here, let me do it. And there, let me have your arm. So from here, what we're going to do is I'm going to rotate him down to the level. So I want to go down to L4. So from here, let me do it. So I'm going to feel L5 to 4. So I'm going to slowly pull him down until I feel tension down to that level. So we flex from below to initiate opening, and we are flexing and rotating from above to initiate locking here. This hand onto his wrist. Out of all the technique I show, if you came back on another course, you'd probably say to me, this is the one you'd need more practice on, yeah, rather than the other ones. $1 million roll is his nickname. Why? Because people, osteopaths, make potentially a lot of money. Not all osteopaths. From there, arm comes through, like this. Now, what we're going to do now, if you remember two things, the two things I'd like you to remember is, when you manipulate, I roll as if he's going to fall off. Okay, so the first thing, from here, I'm going to roll as if he's going to fall off in this position. Some people will cavitate just on this position here. So from this position, okay? Now, you just have to fine tune a couple of things here. So roll as if he's going to fall. And then the second thing is to get your body weight up and over. So you're going to get your weight up and over on him here. There you go. Okay, he's already cavitated, okay, just by doing this movement here. Now, so from this position, I'm just going to mobilize. Can you see I'm just mobilizing with my forearm into, people use elbows, they won't like any of it, okay? Elbows, they won't like all this pressure in here. They also don't like the elbow into his ribs, okay, in his counter rotation. So the movement is a flatness of the forearm, but it's not so much my forearm, it's my body weight over my forearm, and I'm mobilizing through my forearms, yeah? Okay, so I'm mobilizing through my forearm. Now,
Are you just pushing?
I'll show you, yeah? So the people think it's a rotation manip, but it's not. It's a rotation mob, but it's not. Because remember earlier, I've already given you the piece of the jigsaw puzzle, we've only got 1 to 2 degrees of rotation. So if you want to cavitate, we have to rotate to lock and side bend to open. So the movement is more down the length of the femur here. So the thrust in, if you like, is going to be more in a side bending motion rather than a rotation.
Okay.
Now the neck is more rotation to open or to close, depending. So from here. Now, what we can do from here, if you don't like this, some of you won't like to do this, do like an MET. You can use the knee, push up against my hand. So he is just trying to initiate contracture of the muscles here. Basically trying to close, he's already closed, let's say. Relax, take a breath, and then from there, you can use the knee as a lever, or you can use your knee on his knee, and then you can mobilize using that. Rather than using forearm, you can just use your knee to mobilize. Okay, or you can almost do these techniques here. Yeah, this is feeling, this is not doing anything from there. So that's almost like what we call a kickstart technique here. Now, if you decide to, let me just show you, my patient would never be there this long. Okay, so if you are going to have a go at manipulating or cavitating this facet, it's not so much rotation because there's not much. You almost have to rotate to tension and then the thrust is more there. Side bend, see it? Side bend. So you want to side bend to thrust rather than rotation to thrust. If you are going to thrust, it is a continuation of what you basically done. So from there, you can already see his cavitated just on the movement. So I'm going to rotate him. So I'm going to get my body weight over. Okay, so my thumb is feeling, you can see it's mobilizing. Take a breath in. And as he breathes out, lock, and the thrust will be there. All right? Yep. Good. Let's go outside.
And was that just the one thrust, Captain?
Yep.
Just the fight?
Of course. Yeah. Okay.
Yeah.
From there, let me just, I might vary this one just to show you, because Peter mentioned about L1 to 2 to 3 to 4 and things like that. Okay, so the bottom leg, oh, he's quite sweaty there, you're nervous. You're nervous, he's clammy, not me, I should be clammy, not him. Now from there, all onto there. So from there, okay, so there's 5. So remember the two things? Roll as if he's going to fall. From there, good. Get your body weight over. Body weight's over, take a small breath. Breathe out. There you go. Good.
What do you do with your left hand?
Nothing.
Nothing at all.
Stabilize. Okay?
Are you specifically opening or closing the thrust?
Open.
Or even both
Open.
sides?
Yes. Yeah.
Anyway,
Yeah. Okay. Alright, so it's not, you can see there's not too much force there. Okay, the thing is I spoiled it. So that's more, if I wanted to do a variation, Nina, can I just use you for one? Just put your head there. Like, let's say for instance, instead of 5, 5, 1, you can do 4, 5, 3, 4. Yeah. So you're not going to be able to do them all. But let's say I've done 5 on Nina. But let's say I've decided. Let me just recap this. If I bend her knees, I can put her knees on me. Okay, and then I can flex and extend, and I can do motion test in here. So I can flex to open, extend to close, flex to open, extend to close. Okay, so when the osteopath would learn this, you might say, well, let's do L3, 4. Extend our bottom leg, please. So from there, and then we put the leg. So we're almost in that position, so we know where we are. I swap my hand, so I know where I am. Hand there. Let me do it. So I'm going to hold her upper arm, and I'm going to pull her into flexion rotation. Okay. Also, the neck would be facing up. And here, so this is more 3, 4. Relax. So 5, 4, 3. I'm going to change my position. I'm going to use my knee.
Oh,
What's that?
I've got a bit of
You got normally.
Well,
Okay. Okay. Well, this is a contraindication. Yeah, because if she's saying to me on a 1 to 10, 10 being painful.
I was about 3 or 4, just took me by surprise.
Okay. Yeah. Because okay. So if I just move, I'm going to change the angle a bit. So I'm going to come in that way. What's that doing?
Is it a pulley
Pulley where?
in there?
Okay. Okay. Let me just okay. If it's not passing a 5 or 6, it'll probably be okay for me. If she says it's a 7, I'm not going to do it. Take a small breath. From there, so I'm going to come over, give my weight over. I'm just going to lock her there. You see, I just teased it. Okay, so I just teased it to cavitate. You alright?
Yes.
Yeah.
Do you feel alright?
Relief.
Yeah? Okay, I'm used to it. I'm used to everything. There was nothing I haven't seen. Okay, in this field. So you can see, but that's good though, because it's good to have patients where they feel something, and you just have to adapt accordingly. Yeah, because most people go, oh, I'm not going to do anything. But if it's like a 3, initially, of course, you could say it's a 6 or 7. I go, oh, I'm not sure if I'm going to do it. Because you can irritate quite easily. Yeah, those of you are a bit stiff, you're not sure what's going on. Okay, but what I did, and I did a 3, 4, so I just teased it and just teased the minute on it.
Oh, it's mine. I'll turn it off in a minute. Sorry.
Time to
wake up. Sorry, don't forget to pick my daughter up
Yeah.
from school.
So the only difference is that I rotated not to 5, to 3. Okay, so I rotated less, if you like. And then my focus, instead of 5 to 4, it's on 3 or 2. So I rotate her a bit more to come over, when I get my body weight over, but I'm feeling here. I'm mobilising this area.
So you're doing something with your thumbs?
I can, but not for this demonstration. Because I can lock with my thumb, and I don't need any rotation, I can just vary it. As I said, we can spend a week on this. Yeah, but I just want to show you quite a simple. You have a question, Peter? You're right.
Yeah, I was going to say, with the chiropractors, they do a huge rotation.
They're huge. I know.
So I know it's not a lot of rotation, but
Yeah.
they bring the leg right over.
They do.
And then
A lot of time they'll let the leg hang, yeah, right off the edge. Like on my second course, I'll do a few more variations, like with a kickstart technique. I quite like that one. Yeah, but they will use the body weight, and
it's a
it
much
will
more
be.
dangerous technique, though.
Well, it will be because it's a force. Yeah, it is a direct force. I'm just trying to show you technique.
Yeah.
Okay, because I think if you give a body the right ingredient, yeah, then it's waiting to release. If you're forcing it, you wonder, no offense, but my chiropractor will always say to the patient, you might feel that one for a few days, knowing damn well you will. Okay, because he's just over-rotated and over-thrust. Okay, and a lot of people can feel worse after treatment, yeah, rather than better after treatment. Yeah, but I'm hoping my patients don't say that. Okay, hopefully. Yeah. That's what I mean, it's about the angle of execution. Okay, if you are, a specific way you are going, like I'm saying, that was an L3, the one before was an L5. Yeah, so I'm hoping that I'll only manipulate where I feel it under my thumb. If I manipulate too above, it annoys me. Yeah, because I've lost the focus. Okay, but I always think, how long does it take? You need to be able to do 1,000 of these at least before you're getting anywhere. Okay, sounds a lot, but it's not really. I've done 100,000. Yeah. Okay.
Is there a different technique to close the joint?
Different technique,
Okay.
close. Yeah.
Just try to get my head
Well, I
around.
might show you something later. Yeah. Yeah. Only thing is, because there's a few of you, I'm always limited on time. Yeah. That's the only thing. If it's like 10.